External rotators. The infraspinatus muscle lies on the back side of the scapula and is right next to the teres minor. Both these muscles externally rotate the humerus, and we will work on them together. Trigger points in the infraspinatus here refer to the front and side of the shoulder and down the radial side of the arm. Trigger points here refer to the vertebral border of the scapula. In order to assess the infraspinatus, bring your client's arm off the table and have them forcefully externally rotate their arm against your resistance. Any pain indicates inflammation. In order to work on the infraspinatus, stand next to your client and use your thumbs to glide gently from the origin to the insertion with 3 strokes in a fan pattern. Then search for trigger points with your thumb or knuckle. When you find a sensitive spot, hold for 10 to 30 seconds. To friction the infraspinatus tendon, place your client's hand on their back to stretch the tendon. The tendon is located just inferior to the spine of the scapula. Apply cross-fiber friction to the tendon in alignment with the humerus for 1 to 3 minutes. Lastly, use your elbow and glide down the posterior part of the deltoid. Then reassess the group for pain. Abductors. The supraspinatus lies on top of the scapula. Its action is to abduct the arm. In order to assess the supraspinatus, your client abducts their arm against your resistance. It's easy to use your leg. You can also test in this position. Sometimes pain will show up here. If there is any pain, then work on the supraspinatus. To work on the supraspinatus, stand next to their head and use your thumbs to glide laterally on top of the trapezius between the bones of the clavicle and the scapular spine. Next, apply static pressure on top of the supraspinatus while your client abducts and adducts their arm. Alternately, you can do this motion for them. In order to cross-fiber friction the supraspinatus where the muscle meets the tendon, have your client position their arm away from their side in abduction. Place your thumbs between the clavicle and the scapular spine as far lateral as you can. Rotate your thumbs, ceiling to floor. This will cross-fiber the area. Next, use your thumbs to gently twang over the fibers of the lateral deltoid, releasing this muscle. Finally, retest for pain.